But then when you see the whole individual and what it did for just removing a little bit of fat underneath his chin, the confidence that gave him, he absolutely, I mean, it's night and day difference for him. And so when we can be a part of changing somebody's life, it's pretty cool. And psychologically, he wanted every single tooth. So most of the time when we replace teeth and they don't have any teeth, we do it with 4 to 6 implants called all-on-4, all-on-6. He wanted all 14 replaced. So wow. I ended up sending him to an oral surgeon. They had to do extensive bone grafts. It took 2 years. He got 28 implants with 28 crowns. And he was so excited. Okay, so Ozempic, the drug, the super weight loss drug,
yeah,
which is extremely expensive, but it's one of the most profitable drugs ever.
I know.
In the time that it has been. Do you ever think that we're going to have a drug that's going to give us all the protein, the muscle makeup, basically you get this perfect physique by just taking this pill? Do you think that'll ever come? Welcome to our podcast, Riding Shotgun with Dr. McRae. And today we have a special guest, Nate. You're gonna have to tell me your last name because I always get it wrong. What's your last name?
Yeah, hi. Nathan Borgerding-Nilles. Borgerding. So I tell people it's just the 3 syllables. Borgerding, and then Nilles.
Do you have to spell it for everybody?
Do
you ever go just by Nilles?
I don't.
Or Borgerding?
I think my mom has told me in the past, like, hey, change your name if you want to. My wife chose just to go with Nilles, so she doesn't have to deal with it because she's a nurse, and so going.
So wait a second. Okay, so you've got your mom is
the Borgerding.
Borgerding.
Yep.
And the dad is
the Nilles.
The Nilles. So
yep.
Is it hyphenated between the two?
Yeah.
Okay.
Well, it is. Interestingly enough, it is for me, but my sisters, they didn't get it hyphenated, so it's just
the whole deal.
Well, it's just a space. They don't have the hyphen.
Oh.
Yeah, I don't know. I think they thought that they didn't hyphenate mine because that wasn't their intention. But then on my birth certificate, it's hyphenated. So it's what we're dealing with.
Yeah. So, but your wife is just
Nilles.
Just Nilles.
Yep.
You have kids?
No.
Have you talked about it?
Yeah, we haven't. We said we're not going to deal with that.
So is it going to be?
I think we're just going to go with Nilles.
Okay.
Yeah.
You know what? Do you?
Yeah.
That's awesome.
Yeah.
Okay, good for you. I think at least you got it figured out, right?
Yeah.
So, Nate, tell us how did we get to know each other? What ended up with you?
Well, I got brought on to do some podcast stuff and brought on to kind of help out with some of the back end stuff for video production and things like that.
So Nate runs our podcast. And we thought it would be a good idea for you to kind of understand who Nate is. He does an amazing job. And we hired you how many months ago?
I think it's been 4 months.
And you've hated all of it?
I've loved every second of it.
Have you really?
Yeah, I really, really have. I'm not even kidding. No jokes there. It's been a huge learning curve for me. Because
what did you do before this?
Oh, I've done it all. Well, I was going to school for exercise science. I wanted to be a physical therapist.
Okay, wait a minute. From exercise science,
yeah.
So you did the kinesiology classes,
yep.
All of that?
Yeah.
Oh, I'm sorry. Okay.
And actually, to be honest, to back up even further than that, in high school, I wanted to be a cardiac surgeon. So, and my mom worked at the hospital, and she was able to get me in on 2 CABGs, like the coronary artery bypass surgeries, and I thought it was so cool. And so that's what I had planned to do. I went to school. So at first I was going to college for biology. So then that would help me get into pre-med. And then just kind of one thing led to another. My roommate was morbidly obese, and I was really into fitness and exercising and stuff. So then I kind of helped him along the way, and he lost a lot of weight, and it was just very fun for me, I guess. And so
you thought, okay, I'm going to switch and I'm going full exercise science.
Yeah.
And what did you think? A physical therapist, that type of thing was?
Yeah. First on my mind was personal trainer.
Okay.
But personal training is not really what it seems to be. It's a lot of sales.
Is there a few personal trainers out there?
There's quite a few, yeah, exactly. So, and everyone thinks they know the secret sauce. But then when you realize it comes down to a lot about just like the people you're dealing with and their level of motivation, and you can help them as much as you want. You can think you have all the answers, but it really lies on them in the end.
Okay, so right now, in fact, I just heard this, Ozempic. Do you know what that is?
Yeah.
Okay, so Ozempic, the drug, the super weight loss drug,
Yeah.
which is extremely expensive, but it's one of the most profitable drugs ever
I know.
in the time that it has been. Do you ever think that we're going to have a drug that's going to give us all the protein, the muscle makeup, basically you get this perfect physique by just taking this pill? Do you think that'll ever come?
I think so. I think if you look at like the myostatin bulls that they have out there where they're genetically modified to have these crazy muscles, and then you look at like performance enhancing drugs and just how far we've come from like the 50s and 60s with that.
Oh, that's a good point. If you think about like even the steroid use, they kind of, let's get real. The Rock.
Yeah.
I mean, The Rock, he takes steroids.
Yeah.
I mean, there's no way he can get it, but he's really healthy. He's not, he doesn't have back acne and all over the place, and his testicles probably are not, tiny little grapes.
Yeah.
But I mean, that's what happened. And they went crazy when they first were doing steroids. Still, I think I have enough knowledge about steroids. I don't want to do that. I don't want to go into that. I guess I do think that there will be a day that you can take a pill. It's going to be an appetite suppressant. It'll give you the correct amount of muscle. But will it ever get to the point that you're going to be able to have your VO2 max at where it should be without doing the actual work?
Yeah. I mean, I think if you look at it from like a chemistry and like biology point of view, I think like getting there through medicine could be possible, but I kind of see it more through like nanotechnology. And like, if you think about just like your blood cells taking oxygen throughout your body, having like nano particles in your body where they're shuttling far more oxygen and it's much more efficient and things like that. I could see that happening before like a magic pill, because I think the human body is so complex and we have a better understanding of technology.
So let's think about that for a second. If you really think about being able to have nanotechnology, all of this without doing the work, what is that going to do to the psyche of the individual? Do you think that it actually is going to be a potentially positive? I see it potentially could be a very big negative.
Yeah, no, I totally agree. I think the interesting part for me in my job is I get to sit back and listen to other people talk on the podcast. And often, whether it's on the dental podcast that you're doing or, the nurses podcast that we have, everyone always talks about their journey and their process of getting from point A to point B and, the struggles that they've had along their way. And when you just take a simple pill or you get something handed to you, I don't think you appreciate things in the same way as someone who's worked really hard for kind of their life,
Well, I think back to, I was actually in Chicago. I was teaching in Chicago and I had an Uber driver, and she was taking me to where I needed to go. I think it was from the airport to my hotel room. And we started talking about, she started telling me about her daughter and how she had just lost her husband, and she was not making it financially. It was really a struggle for her. And she had this dream for her daughter to go to a university. And so her daughter, she had to go to her and say, and she was just in tears. She literally was crying in the car because she didn't have enough money to be able to send her to a university. She had to send her to a community college. It was literally like 1/4 of the expense of the university that the daughter wanted to go to. Well, the daughter was just pissed. She was so mad. And the mom's like, I don't have any other option. And she was just really distraught. And I thought about it for a minute and I said, do you realize the gift that you gave your daughter? And she goes, what are you talking about? And I said, well, I kind of equate it like this. There is parents that have an ability, think of a mountain that you have to climb. And there's parents that want to get their children all parents want to get their children to the top of this mountain.
Mm-hmm.
And we're trying to get there to be able to see the sunrise, let's just say. Well, with your daughter, you are going to climb that mountain with her every step of the way. There's some parents that are wealthy enough that they can literally take their child in a helicopter and put them on top of that mountain.
Mm-hmm.
So you tell me which one is going to be stronger when you actually are seeing the sunrise.
The one who struggled.
The one that actually did the work is going to be much stronger.
Mm-hmm.
She sat there and then she really started to cry. And she goes, I think you were a gift from God. She literally said this. I think you were a gift from God to tell me exactly what you just told me. I'm going to go home and tell my daughter, you know what? I'm giving you a gift. And I was like, okay, yeah. But I actually felt good. I was like, yeah, that it just came to me to be able to tell her that.
Yeah.
I think that we sometimes look at the struggles that we go through. Boy, I've had a lot of struggles myself. We look at the struggles that we go through and we don't realize how strong that has made us.
Yeah.
And we're not grateful for that strength. If someone just took a pill, and I don't, I think it's wonderful for those individuals that are losing weight from like Ozempic. But to just take a pill and be able to have all the physiology of someone that has worked out their entire life, they're never going to understand. And then potentially I could see it being a mental thing for them in the future.
Yeah.
I mean, you look at, okay, I just looked at this statistic of we have never had the amount of suicides that we have had in the world, especially in the United States. It is higher than it's ever been. Why do you think that is?
Yeah, just like the complacency and lack of having to really work hard for a lot and kind of just having so many things given to us, essentially.
Well, think about do you know what year the iPhone came out?
2007?
Yeah, exactly. 2007. Since the iPhone came out, I think it's something like 97% of the United States from 13 years and older have some sort of cell phone.
Yeah.
Okay. And it's tripled our teen suicide rate. Now, is that all contributed to just the iPhone?
No, but a good amount of it. Yeah.
Yeah. Has it made our lives easier?
Yeah.
And we don't have to work as hard?
Yeah.
And well, let's think about what AI is coming.
Mm-hmm.
I listened to a podcast and they said by 2035 and guaranteed by 2045, almost all jobs are going to be obsolete.
Yeah.
Then what?
I know.
I mean, all jobs.
I think some people are extremely self-motivated. They love to kind of learn and grow as a person regardless of their job or their career. And then I think there's other people that really rely on that structure and kind of having someone tell them what to do and like, having a kind of rigid routine. So I think some people with the lack of a job and just kind of the freedom would really thrive, but I don't think the vast majority of people are like that.
Yeah, I think that there's. I just think of myself. I find a lot of joy in what I do,
Mm-hmm.
and I think of. I mean, there's a lot of different options that I could have went down. I actually was studying to be an attorney, and that definitely was not for me. I mean, I like to get in and I like to actually be able to do things, and I love dealing with people. Not to say anything wrong with attorneys, most of them are sharks, but but I think of the different options that life could have taken me. And I really do. I love working with a team. I love the team aspect. I love working with people. Is every part of my job fun? No. Um, I think the thing I love the most is learning and trying to improve concepts. That's one of the things. What are the things that you love about what you do?
I think, yeah, the learning part is huge. I think anytime I get stagnant in a position where it's like kind of mundane and it's the same every day, those are always things I don't really enjoy. So for me, it's just constantly, there's so many things going on. There's so many different projects that need to get completed. There's lots of things that I'm obviously learning on my own. And so for me, it's just been, I mean, that's been the most enjoyable part for me, is kind of the growth and being able to also just being able to be in a smaller size company. I think that's huge. I think anytime you're in a really big company, it's just, you're just lost. You're another cog in the wheel. No one really truly appreciates what you do. And I think there's a lot more like rules and everything like that. So I've just never really gelled with those kind of environments. So I think that's a big part for me, is why I enjoy it, is the small team and kind of really feeling like you're a part of everything.
And so right now you're working with, what companies are you working with? So Five Square Aesthetics.
Yep, Five Square
is kind of your big one that you do a lot with.
Yeah.
Can you explain what Five Square Aesthetics is? I'm one of the partners, but why don't you tell people that are watching this what Five Square is?
Yeah, I mean, Five Square is basically giving nurses kind of the tools to tackle the aesthetics industry, while, being able to have all the help and the guidance that really would be difficult to kind of go out on your own and learn all this stuff, or, figure out the different tools you need. And then things just kind of start cascading in terms of money, because you need to acquire this, you need to buy this. And so it's kind of like all in one package for nurses who are wanting to do anything in aesthetics.
So it's kind of like the ultimate package for a nurse to be able to do the ultimate side hustle.
Yeah.
To be able to start their own aesthetic practice with the legal work, all of the training that they would need, the supplies they would need to be able to get going, and then the continual support for nurses. And it's amazing how fast this is growing.
Yeah. I know my own wife is doing it too, because I would go home all the time and talk to her about it and say,
so your wife's a nurse?
Yeah.
Oh,
and
okay.
So she jumped on, and she's working with another coworker from her actual job, and they're working together, and they're super excited. They're meeting all the time, discussing.
How's it
what they're
going
gonna
for
do.
them?
It's good. She just started, just as getting through the process, already has people lined up, but they're just trying to get like all the paperwork done. So they are literally waiting with like patients ready or clients ready. So that's
That's fantastic. The first time I learned how to, it's kind of crazy. So Dr. John, who is actually my nephew, is the one who's running the training program through Five Square Aesthetic. He's a nurse practitioner. So I started learning how to do Botox long time ago. Took some courses. It was kind of pretty foreign to me when I first took it. Started practicing, and then I started doing things on patients. And then I had this one injector that showed me some of her techniques. And from there, it just kind of clicked with me. And so when John joined and we started what was called Mountain West Medical, he started doing some aesthetics. He took an aesthetics course, and they taught him, in my opinion, the wrong way. And he'll even say that.
Yeah, I've heard him say that.
And so he had some adverse reactions, which, boy, you learn more from adverse reactions from patients, and the patients were very happy.
Yeah.
And so he came to me, and I showed him some of the things we do, and then he took it to a whole new level. I mean, it's amazing what he has done. And he's a much better injector than I am. And so what we see is then him teaching other injectors, and they even become better than him. Mm-hmm. And so it's, which is totally great. That's exactly what we want. But when you first are starting, you need a little bit of a push. And it sounds like your wife is getting that push.
Yeah, exactly. It's exciting. I think the concept is it's one of those concepts where when you hear about it, you're like, oh well, yeah, of course that makes sense. That's a smart thing to do. But no one had really tried to tackle that before. So I think it's a perfect fit for especially things that I've heard from say the Nursing Stories podcast, which we do. Uh, Nurses really, especially after 2020, in that time frame, they're really burnt out and they're tired of bedside nursing. And I think that shows in terms of like recruitment for hospitals and everything like that. It's just, I think a lot of nurses are overworked and not really appreciated.
Oh, for sure. I mean, they are definitely overworked of what they do, and how they're treated.
Yeah.
Yeah, and then the hours that they have to commit to. So we have individuals that are side hustle, but potentially big enough that they can just go out on their own and just do this.
Yeah.
Which I think is really appealing, because one of the nice things about doing this is that you set your schedule. You decide when you're going to be working with patients.
Mm-hmm.
And there's many, I mean, if you look at the trajectory of, let's just say, biomodulators, which is like Botox, Xeomin, Dysport, those, you look at the projection, it absolutely is going to just continue to climb. And even if the economy, do you know what the lipstick effect is when you have a downturn economy?
Mm-mm.
Lipstick effect is that no matter how bad the economy gets, there's always going to be sale of lipstick.
Okay.
Do you know why?
I mean, beauty industry, beauty standards.
So women, especially men too, they're always going to want to look good, even when the economy just tanks.
Right.
So the lipstick effect is that they're always looking for, let's say they can't do the big, huge surgeries to make themselves feel better, but they can do the little things like Botox, the fillers, that. So there's always an industry there.
Yeah, that makes sense.
Yeah, it's kind of cool. So there's another business called Breathe Airway.
Yeah.
You work with them.
Yeah.
Okay. And how's that working? Tell me what you know about Breathe Airway.
I mean, I'm really into podcasts. So I'd known about airway issues before because I'd heard them from, Lex Friedman or Andrew Huberman or Joe Rogan, kind of those bigger names in the space. And so I knew about it, and I knew I had snored for a long time in my own life. And so I kind of had been working towards, less mouth breathing, better kind of knowledge about that, and just making sure that I breathe through my nose and didn't mouth breathe all the time. But yeah, listening to kind of their story and then listening to them on the podcast and the things they're talking about, it's definitely been pretty eye-opening for me.
Yeah, it's pretty amazing. If you really think about even maybe 2-3 years ago, you hardly heard about this at all.
Yeah.
And I think that finally the medical community and the dental community is understanding the importance of nose breathing. For years, we just didn't even know. I didn't know. And I couldn't quite understand why patients had some of the issues that they have. I went, and I know I've said that's on another podcast, but I went to Africa. When I was in Africa, we saw 700 kids in 5 days. We did this mission trip. I was amazed because all of their teeth were perfectly straight. And I'm like, why are theirs straight? Out of the 700 kids, there might have been 20 that didn't need braces.
Yeah.
And if I saw 700 kids in the US, maybe 5 wouldn't need braces. And I'm going, so, okay, something's different. It's not genetics. It's not that. Something else is going on. So if you listen to James Nestor, Andrew Huberman, Joe Rogan, you listen to these guys and some of the guests that they have on there, it's pretty well known. It's just because we're so wealthy, we like fast food.
Yeah.
I mean, think of this. How long does it take in your family to make a Thanksgiving dinner?
Oh, hours.
Yeah, it literally, in our family, my wife is brining the turkey at least a day and a half before, and she is making everything, I mean, all the different fixings the day before. So it's more than 24 hours. How long does it take to eat Thanksgiving dinner?
I mean, like with the conversation and everything, a little longer than a normal meal, but yeah, still very, very quick.
30
like 30
minutes?
minutes, yeah.
Yeah. And so, but how long does it take to eat McDonald's?
10.
It's 5 to 10,
Yeah, 5 to
right?
10,
But
yeah.
if you're hungry, it's done in like 5 minutes.
Yeah.
So I heard this. It used to take as long as our ancestors, it took them 4 hours to consume their food in a day. Now think of that.
It's a big,
4 hours.
big part of your day.
Your big part of your day is actually consuming the food that you gathered or you hunted,
Mhm.
and most of that was hunting, and they're gnawing on whatever, like, I guess like jerky. When I'm going, boy, that's some really tough jerky.
Yeah.
But their jaws got really strong. And what the other thing is if you look at ancient humans and you look at their skulls, they all have their teeth. And you're going, okay, so. And then I think of a patient of mine when I was first starting my practice. He was in his late 50s, and he had been to his dentist he said he was 15. And at 15, the dentist said that he was going to lose all of his teeth, so he just took all of them out. So he's now in his late 50s, early 60s. He comes to me and he wants implants. And this is years ago. And psychologically, he wanted every single tooth. So most of the time when we replace teeth and they don't have any teeth, we do it with 4 to 6 implants called all on 4, all on 6. He wanted all 14 replaced. So
Wow.
I ended up sending him to an oral surgeon. They had to do extensive bone grafts. It took 2 years. He got 28 implants with 28 crowns. And he was so excited. Crazy story. He ended up divorcing his wife because he felt all this, like, I guess, self-confidence.
Mm.
Went down to Brazil, got a 20-year-old girlfriend, brought her back, married her, came back. A year later, she left him, and it was kind of a mess for him. And then I never saw him again.
Interesting.
Yeah. I don't know why that popped in my head, but
all from some teeth. What teeth can do for your confidence?
Their teeth, and you think about that with going back to Airway. I think of some of the patients that I've treated, and I realized the majority of it was an airway issue.
Mm-hmm.
In fact, I have a lot of times patients will say, why hasn't any other medical provider told me about this? They simply just don't know.
Yeah. Well, and to me, I think what's the most interesting is there's kind of the obvious things that you'd think of when you hear about airway and kind of the mouth breathing and breathing through your nose. Those are like somewhat surface level, but to me, learning about just like anxiety, ADHD, all those things that kind of follow with it, or just like poor oral health, and learning about kind of the mouth and wanting it to be that kind of moist place instead of being so dry from people like mouth breathing at night, and just kind of hearing those things to me was very interesting. And I kind of made a lot of things click finally with me in terms of my struggles with snoring and everything. But yeah, to me it has just been really, really interesting to hear them talk about that.
So where are you at with your journey?
Well, you know what, I will admit something. They said on the podcast, Dr. Chelsea Todd was saying she doesn't really think that, taping your mouth at night is like a good idea unless you've kind of gone through some other stuff, just because it can be kind of dangerous, obviously. But for me, I started doing that a while back before I started working here. And so for me, that I find that works the best. If I don't tape my mouth at night, I wake up the next day and I just, like, it's not like a noticeable thing during the night. Like, it's not like I'm not waking up as much, but it's just the next day I notice something. Like, I notice like feeling a little bit more tired, not like quite as there. So I'm assuming that I'm probably waking up through the night. These kind of micro, bringing myself out of sleep, but I'm just not waking up enough to remember it. That's the only thing I could think.
That's what's wonderful about medicine. We can all have our different opinions, and Dr. Todd is amazing. And I agree with her on some aspects. And if you just took a piece of tape
Mhm.
and you said, okay, I'm going to go to sleep with this piece of tape, and you put your tape on, yes, it could be potentially you're not going to get enough oxygen. I don't know that you necessarily are going to be, it would be deadly because there would be enough of a response from the person, but could it be? Yeah, possibly. So what I tell patients is that if you're going to tape, get a good tape. The best is that we know of is Hostage Tape from hostagetape.com. And no, they're not a sponsor, but I do think it's a really good tape. It's called hostage tape because you literally look like a hostage.
Oh, it's like the X?
Yeah. Well, no, it's a big piece of black tape.
Oh, okay.
And so you put it on. It's good for beards. It's good for skin. There is a trick, and then you put a little bit of chapstick on your lips because it will stick to your lips. So that's I got that from a patient. But what you want to do with taping, and the best way to tape, is that the first night, do not go to sleep with it. So let's say you're going to watch something. You put the tape on, and if you can tolerate it and breathe through your nose, let's say for a half hour, great. Next night, go an hour. If you can get to an hour with the tape on, it's not going to be deadly. So what does that do? It is truly a big Band-Aid.
Right.
And all it's doing is that it is sealing your lips. But that Band-Aid tells you, okay, what is the next thing that you need to do? So if you feel better, you feel better.
Mm-hmm.
So the next thing is to go through the program, Breathe Airway.
Yeah, which is funny because I hear them talking about it, and I was like, I need to get in there. And then I think about, I'm like, my wife, she doesn't snore at night, but I look over and she's, just horrible mouth breathing. And so I just think of, my parents snored their whole life. Funny thing is, I had a room underneath their room, and I would be able to hear them through the floors at night. And it would be like they would be chain snoring. So it'd be like no silence, just constant snoring from both of them. And so I couldn't even live down in that room anymore. I had to move to where we had our office at the time and switch rooms. But,
so you had to switch room because your parents snored so bad?
Yeah, it was so loud. I was like, I can't deal with it.
They got to a point where the snoring was so loud for each other, it just didn't even bother them.
Yeah, they're just used to it. It's crazy.
Have they done anything with their?
Yeah. Well, the funny thing is, it seems a little late in their life, but yeah, my mom just recently got like a sleep study done, and this was probably
never too late. I mean, it's never too late. I've had 90-year-olds that have got sleep studies done.
Really?
Oh, yeah.
Yeah, but the thing I find interesting about sleep studies is, because I had one too, like a few years back, and I feel like a lot of times they'll say, like it's inconclusive. Like, we know you snore, but we don't really know how bad. And then it's like, then they want you to come in and do a sleep study there. And so for me, it's been one of those things, like hearing my mom talk about her experience with her sleep study, and then also getting kind of inconclusive data. I'm like, well, like my new job, I hear about the breathing issues all the time. I'm like, you should go in and get a consultation and kind of, learn what you can do.
I truly think the best one is the one that you do at home in your own bed, in your own environment. And there's some great sleep studies that are done. We use what's called WatchPat. We're looking into a few others that have some really nice features. But WatchPat's great because you literally put on a couple probes, and you put this watch on, you put an app on your phone, and you go to sleep. When I did my sleep study, it was this contraption I put on my head. I mean, it was uncomfortable, and I'm like, I don't know that I'm going to go to sleep.
Yeah.
I went to sleep, and it showed that I had mild sleep apnea. I think, what would it have been if I could have just been my normal movement, my normal self? The one thing that I'm going to say is that, especially for the listeners, if you ever get a sleep study, it makes me mad hearing the verbiage, mild, moderate, and severe. And so what I tell patients is it shouldn't be mild, moderate, severe. It should be bad, really bad, and holy cow, I'm going to die. Yeah. I mean, it's kind of like saying you have mild heart disease.
True.
Moderate heart disease. You have severe heart disease. No, you have heart disease. Yeah. And it's bad. And so what do we need to do to be able to fix that? There is some great options that are out there for patients other than just CPAP. And so that's something that they need to know. But it sounds like you've started the journey. Now you need to finish it.
Yeah.
It sounds like your wife does too.
Yes, she definitely does.
So, and a lot of times patients will say, I don't mouth breathe. If your lips are not completely sealed, you're mouth breathing.
Yeah. Well, and I think this is something that I've kind of heard from listening to the podcast and stuff like that. And something I keep trying to tell her is, she says, well, it's so hard for me to breathe through my nose. And it's like, well, it's because you're used to always breathing through your mouth. And so, yeah, just knowing about also.
And she's in the medical industry.
Yes, and knowing about how I always hear about respiratory illness and like how your nasal passageway helps humidify your air, and it's doing all these other things that people don't realize. And so
Nitric oxide,
yes,
nitric oxide, it humidifies the air. It sterilizes the air. Maybe one day I'll tell you my beliefs on COVID and wearing a mask, which was the dumbest thing that we could have done to the human population, is wear a mask. Thinking about myself going through the airport and wearing a mask, that was dumb. When our natural instinct is to breathe through our nose and then sterilize that air, that is the safest thing we could have done. I'm sorry, stupid Anthony Fauci.
Yes. I think most people are starting to kind of realize that
pretty
kind
much
of stuff.
Everything we did for COVID was wrong.
Yeah. And I think it's more, for me at least, it's more if you're going to make a mistake in the moment, be willing to fess up afterwards and say, hey, going forward, we need to learn from this. We need to change the way we do things. And
okay, but do you think if we went through something like that again, would the mandates be the exact same? Let's just take masks. Will we ever in our lifetime, will they force us to wear a mask again?
I definitely could see it. Yeah.
Oh, absolutely. Yeah. They're going to, they wanted to, in my opinion, they wanted to see how far they could push it.
Yeah.
Masks, if you really want to look at it, the best way of wearing a mask is just over your mouth, not your nose. The nose is the way that we sterilize our air.
Right.
So you're running through an airport, you've got this mask on that is restricting your air, and you are even more of a mouth breather, which is making it more deadly for you. The best thing to do is just, if you're going to do it, just put it over your mouth and really focus on being a nose breather. So with your wife, here's what I would tell her to do. These exercise to the point of, okay, I've got 5 minutes. I'm going to really focus on just breathing through my nose. What she'll see is that her airway passages will open up. If she can't even get to 10 minutes, she needs to go to an ENT.
Yeah.
And she needs to find out, okay, is there potentially some issues that she needs to go through? But if after 10 minutes, she gets to 10 minutes, then 20 minutes. Once she gets to an hour, that's going to be, okay, now I know that I can breathe. Sometimes it's just psychological for her. It's just, I can't do it.
Yeah. I think that's probably part of it.
Because she's been nose breathing or mouth breathing her entire life. Yeah. Which leads to gum disease, periodontal disease, excess cavities. I mean, you start to look at I guarantee you she's had some issues with that.
Yeah, cavity. And she is my tooth care is definitely, as a dentist, you probably don't want to hear this, but my tooth care is not what it should be.
First of all, are you kidding me? As a dentist, I love patients like you that go, I haven't been to the dentist in 15 years. And I'm like, all right, let me at you.
Yeah.
No, don't worry about that.
But then she, on the other hand, she brushes and floss. She has like a whole routine. She has the lower retainer. So she uses the floss that she goes in and out between them, and she still has struggled with cavities in her life and stuff. And I'm like, I'm telling you, it's a big part.
It is not as much genetic as we think it is. It is definitely more of, she is more probably of a mouth breather than even you. And so that's the problem. That's what we see. The first thing, dentists out there, the first thing that you should be thinking about is, are they breathing through their nose or their mouth? When you look and you see that you have a bunch of cavities, don't immediately just think of all the acids like sugary drinks and things like that. First, think of what is the patient breathing through, nose or mouth? That's what I do. And so it's amazing. It's that paradigm shift that I think the medical community has to look at to be able to see where they're at. Is your wife, has she been on any of the journey with the airway stuff?
No, I told her that she needs to get a consultation. I've tried to get her to kind of work on it. I think she's more aware of it now. And I think maybe like during her day. She tries to be more cognizant and make sure she's breathing through her nose. But, so just the very beginning steps of things. And I think too, for a lot of people, it's not an issue till it's an issue kind of thing, where it's like they've done
That's
this
true.
for a long time, and it's only till they've heard something about it and they can kind of like cause and effect correlate it to, issues they've had in their life. Like, oh, my teeth. Yeah, my teeth have been kind of bad, or, yeah, I do kind of struggle with like, having to drink so much coffee during the day to stay awake, and, have anxiety issues and things like
Does she grind her teeth?
that. I don't know. She kind of has a bad jaw, like TMJ kind of
So then
stuff.
she does grind her teeth.
Yeah.
Yeah. So it leads a lot of times to grinding. I have my youngest son. He is a horrible mouth breather, and getting him to even do it is very difficult. But he grinds his teeth so bad, his front teeth. It's amazing, Nick, that you even have a girlfriend. But anyways, it with it's a to me, it's exciting that we have really a different way of looking, and it truly is a paradigm shift from what I learned, to the point that I've even gotten away from fluoride, because I don't think necessarily fluoride is always good for us. There's certain instances that it's good for us, but the things that have been taught to us, I don't believe. I think you have to find out what your beliefs are away from even the stuff that you have been taught, and if it doesn't make sense, there's certain things that don't make sense. Cavities always associated with this, and this. No, it's that you don't have enough saliva that is going to buffer the acid that is created from the bacteria that destroys teeth. So think of it this way. This is what I tell kids. What happens? How is a cavity formed? Do you know how a cavity is formed?
I mean, it would be like impacted food and stuff where it's like kind of growing down deeper and deeper into like the enamel of your tooth.
I'm gonna tell you as if you were a 6-year-old. Okay. So think of it this way. We have these bugs known as bacteria. We like sticky foods. Okay. That's the soft foods, the breads, the sugars, all of that. They stick to our teeth. We get 24 hours to be able to get that off. That's the brushing, the flossing. Okay. We don't always get it all off. And then the bacteria can get on the food. They eat the food, and then they poop. And they poop acid. It's the byproduct of the bacteria that creates the acid, that creates the decay in teeth. So what is decay? What is a cavity? It's bug poop. And what is the job of a dentist? We're the sanitation crew. We go in and we remove all the poop. And then we fill that so that we seal it so that it has a harder time. In reality, if we can keep the lips closed, there's more saliva. The saliva is the buffering agent that brings the bacteria and the acid down. And so it literally removes the acid effect in the areas around your teeth. It's very simple.
Yeah, that's a good way of explaining it too.
Yeah. Well, kids think of the poop, but that's the reality. That's actually what happens with teeth. But anyways, okay. So the other one that you work with is Mountain West Medical.
Yeah.
So Mountain West Medical what is that?
I mean, that's kind of John's.
Dr. John.
Yeah, Dr. John. That's his kind of his practice. Like he started with it. Actually, learned all this stuff when I talked to him last time. He started this in like 2017, I believe, and this is kind of he wanted to do a lot of stuff with wellness, so he wanted to help people, and he just realized over time that kind of introducing some of these aesthetic things into the practice, and those were really the things that people went for. So kind of transitioning more over into aesthetics as the years went on, and eventually it is where it is today, which is, a very successful aesthetics practice, and he does hair transplants. He does all the different stuff with hair, whether it's like medicinal or different surgical options. So he does all that kind of stuff. And then also kind of, moving off from the aesthetic stuff and starting to do the 5 square, giving nurses the ability. So that's kind of all encompassing of it.
Yeah, so they do all sorts of laser treatments on skin. He does a ton of hair transplants and other modalities to help both male and female be able to keep their hair. He does a lot of that. He does liposuction, laser assisted liposuction. It's crazy. I went and learned that with him, and it was pretty funny. We're sitting around a table and, okay, so what's your specialty? What's your specialty? And they started going around the table, and this one guy's like, yeah, I'm a neurosurgeon. And I'm thinking, why are you learning liposuction? And the other one was just, he was like MD, and uh, uh, another one was a general surgeon. I'm thinking, why are you guys learning this stuff?
Yeah.
And then they came around to John. He's like, yeah, he said he was a nurse practitioner. They didn't have a problem with that. I did not want to say I was a dentist. So I said, I'm a maxillofacialist. I didn't say maxillofacial surgeon. I truly believe that my scope is this. So I just said maxillofacialist. And they totally accepted that. Then we asked the neurosurgeon. I'm like, so what do you do? What's your specialty? And he showed us all of these surgeries where he goes from the front of the neck and he goes back and repairs the spinal column in the back of the neck. And he's showing us all of these surgeries that he does. And he was scared to death to do liposuction.
Really?
And then I was like, why are you learning liposuction? He goes, I can't make it financially.
Oh, wow.
Because of insurance. It killed his practice. And so his wife is there, and I'm going, okay, his wife wants the liposuction. She's saying, but you need to get into this.
Yeah.
And she was there with him going, learn this stuff. I want you to learn. And he was petrified of doing liposuction. So I'm thinking, okay, I'm a dentist. I'm petrified of learning how to do liposuction. So I went and took the courses. I did the hands-on portion of it, learned how to do it. And I realized, oh my gosh, this is so much easier than what I do. I work, dentists, you all know this. We work in a square black box, 100% humidity. And it is a trap that is constantly trying to get you. And they're snapping at you constantly. And it's wanting to close. And then the patients are complaining. It's not an easy job, what we do.
Yeah.
Yeah, but I still love it. I love what I do.
It's interesting. The thing that interests me about the liposuction thing, I was seeing some videos of, the machine that you guys have. And I didn't know that they could remove fat from somewhere where you don't want the fat. And then because it's like with the laser and it cuts the fat very seamlessly and everything, you can take that fat and use it somewhere else. I found that super interesting. Like for women, they can get it taken from their stomach and then they can put it in their butt or their breast. And I'm just like, this is crazy. Yeah. I didn't know you could do that.
Yeah. Butt to boobs. I mean, stomach to boobs. I mean, he's doing it. He can take it from the stomach and they micronize it. They actually take the fat, they micronize it, and they can actually do facial aesthetics with it. I think when you look at fat, they've actually looked at it. It has the most growth cells, stem cells, leukocytes. The only place in the body that's better is in the bone marrow. It's absolutely fascinating what fat, the good that comes from our fat.
Yeah.
It's just aesthetically, we don't want it in certain areas, and we want it, especially for women, we want it in other areas. And it's like, okay, I just want it out of my stomach area, and just to remove it there, that would be really nice.
Sure.
Or maybe I can take that pill and just kind of, that'd be great too.
Yeah.
Well, Nate, it's been great.
Yeah.
I've really enjoyed being able to talk to you.
Yeah, it's been fun learning a little bit more about you, and you get to hear about a little bit of my story. So,
well, thank you, Nate. I think what you do for us is absolutely incredible. I look at you as like a partner, and I'm grateful that you're part of our team.
Yeah. Well, I mean, before we go, I think the one thing that for my few months here, 4 months that I've seen so much across all the different things that you guys are up to is just how willing you are to branch out and learn new things. And you guys constantly are talking about like, oh, this, you just now when you're talking about liposuction, oh, we went and learned liposuction. It's just like this constant want for like learning and bettering yourself and growing. And also, I think that hearing Dr. John talk about how, the idea of, growing as a person, but then also lifting the people up around you.
Oh yeah.
Yeah, it's very apparent.
I think of a case where we had a patient come in and we did it kind of a tag team with Dr. John, and this patient wanted veneers done, but then he also wanted his chin. He's like, he had some fat underneath his chin, and he thought, okay, well, I'll just use Kybella. Can I just use Kybella? And he asked me about it, and I said, yeah, it would take a lot of Kybella, and it would take forever. And Kybella is good for small amounts, but not large amounts. And so we sedated him. I did his veneers, and then John and I worked together to do the liposuction underneath his chin. And I show this sometimes when I go out and I teach. And what I love is to be able to say, okay, here's his teeth, and I just show a close up of his teeth. But then when you see the whole individual and what it did for just removing a little bit of fat underneath his chin, the confidence that gave him, he absolutely, I mean, it's night and day difference for him. And so when we can be a part of changing somebody's life, it's pretty cool. I'm excited about, I've got a police officer that went through a big trauma. I'm excited to bring him in and to be able to do that podcast. I'm really looking forward to it. In fact, he just sent us a text today. We just did his upper implants. Tomorrow, we're doing his lower implants. And he, for all these years, he never told his kids he didn't have teeth.
Wow.
And he just told them. And yeah, it brings tears to all of our eyes to be able to help someone like that in our community.
Yeah. Very, very cool.
Nate, thank you so much. I appreciate you being with us and being able to talk through some of this stuff. And it's fascinating. To me, everybody is fascinating. But so just want to thank everybody, and we'll see everybody next time.